As new health concerns arise each day, the need for more efficient, collaborative methods of medical research grows increasingly apparent. In addition to the constant struggle to maintain a healthy lifestyle, worldwide health concerns are now at an all-time high, with the development and discovery of new diseases. These are only a handful of problems facing the medical community today.
I think there's a lot of ills in modern medicine today. I think you don't have to be a doctor to know that. You just have to be a patient to see that there are many issues with medicine, some of which just simply relate to complexity and inability of relaying information from patient to doctor, from doctor to patient, from doctor to doctor. There are major issues with communication.
Problems related to health affect us all, and with so much at stake, key individuals and organizations are coming together to find better, faster solutions. One step toward those solutions involves opening the door for improved communications between doctors and other people involved in the medical community. In the past, many doctors and researchers were spread all over the country. The lack of collaboration created a medical community that was slowed by the inability to combine different schools of thought in the medical fields. One area in particular, gastrointestinal medicine, has been stifled by the inability to treat and diagnose all intestinal diseases from one central location.
As gastroenterologists, we're advocates of colon cancer screening and prevention because colon cancer kills over 55,000 people a year. It's all preventable. We believe all colon cancers begin as benign growths called polyps. And most polyps remain benign, but for reasons we don't really understand, a very small percentage will turn to colon cancer.
Diseases and conditions such as irritable bowel syndrome, colon cancer, and hepatitis B and C have become a serious concern for those at medical risk. Although the risk is present, the lack of access to gastrointestinal testing and facilities has proven to be a dangerous threat to our communities. Paired with the inability to treat certain intestinal problems at some facilities, gastrointestinal diseases are an ever-present concern.
We know in this country that the lifetime risk that somebody faces of developing colon cancer is about 6 to 7%. That risk is not that high when someone's young, but goes up as they get older. And we know that it really starts to jump around age 50, and therefore that's why there's a national recommendation for the average patient to be screened with colonoscopy at age 50.
Digestive Care has been at the forefront of treatment and technology by providing quality care and state-of-the-art technology. By assembling a group of over 45 doctors, Digestive Care has been able to offer a wide range of treatments for an even wider range of gastrointestinal conditions and diseases. These medical professionals, by focusing on different areas of disease and utilizing various schools of thought, have created a community that provides more options to any patient suffering from digestive problems.
Medicine has always been a very collegial science. From the beginning, you're taught that teaching is as important as taking care of patients, and there's always been a free exchange of information among physicians. To have a large group where that free exchange of information is facilitated is a tremendous advantage.
The new technology is remarkable. I mean, I started this many years ago in the days of paper, endless mounds of paper, caused confusion, disorganization, and had an impact on quality patient care. The new system, such as the EHR, is remarkable.
So, patient can come in and be seen in my office for a consultation, and say, for instance, they have Barrett's esophagus, and I want them to have the treatment to get rid of the abnormal lining. I can call one of my colleagues in Coral Springs, who's part of Digestive Care, specializes in burning or treating the abnormal lining of the esophagus, and have them seen there a few days later and be in their endoscopy center within a week, have that treated.
Gastrointestinal treatment and research at Digestive Care has been developing at an amazing pace, and their qualified group of doctors utilize the most up-to-date therapeutic protocols to help develop cures for hepatitis, cancer, and Crohn's disease while using the most advanced medical technology available today. The goal of Digestive Care is not simply to research these health risks, however. Routine colonoscopies after the age of 50 can help prevent cancer by discovering and removing polyps at an early stage. Digestive Care has become a hub for all intestinal-related tests and queries, and is a one-stop facility providing the most thorough tests and colon screenings. By focusing on disease prevention as well as treatment, Digestive Care has made strides in lessening the burden of treatment and testing.
Gastroenterology has really exploded as far as the technology that's available to us, and we see patients of so many different types of conditions that it's impossible for one person to really be an expert in all of those conditions given all the new technologies we have, and therefore it's nice to have subspecialists within gastroenterology who can deal with one field at a time.
Another tremendous benefit to our group is our ability to provide really a comprehensive approach to their care. We have a digestive care pathology lab. Now we have our own pathologists. We will soon have our own imaging centers. We will soon have our own infusion centers. And by doing this, when a patient needs an infusion or a CAT scan, or they need their slides reread or sent out, all of those services are coming from within our group. That greatly increases communication. It reduces turnaround time in getting the information to the doctor and then in turn to the patient, and it streamlines the care that the patient requires.
It's very convenient for the patients, and it's much more efficient, and it's more seamless care than they might get in the absence of being part of one of these large networks.
By staying at the forefront of technological advances and therapy, as well as offering efficient and effective care for all patients, Digestive Care is leading the way for all medical institutions in our journey to a happy and healthy future.